Right, so when I read this, a few things, I guess, are there different plans, like A, B, C, and D, or I'm not really sure what the differences are for this. Do you want to explain that to me?
Oh, sure, absolutely. So, as you know, there are 4 parts. So, they're not different plans, essentially. It is the health insurance coverage that is the plan. And then depending on what parts you have, will decide what we help you with. So, with Part A,
And then just one moment, please. Okay.
So if you have Part A, that is our hospital insurance, which means that we help you pay for inpatient care at either a hospital or like a nursing facility, which would be like a hospital day, like a hospice care. And so if you get injured to the point of needing to stay at the hospital overnight, if you are admitted beyond the ER, then you're considered inpatient. So injury, surgery, mental health.
Clarifying right now. And I do have a question in a moment. And then one quick question related with diabetes. So suppose I notice I am low and I have to go to the hospital. Is that plan cover that?
Yes, if you are dangerously low, dangerously high, and you need to go to the emergency room right now and cannot wait for a doctor's appointment tomorrow, yeah, go to the hospital, and absolutely, because you could die from that, and they will admit you, and you will be in inpatient status.
Oh, that's very cool. Yeah, I'll have to check box that for
Yes.
you. Yep.
But with that, the other parts definitely are important, especially Part B, which is next. And so that is the medical insurance, and that pays for services from a doctor, which means a doctor's appointment, or if there's a referral to a specialist, or if there's a workshop for diabetic care that your doctor says go to, and you have to pay for it, we can help to facilitate that.
Could you give me an example of a referral? What do you mean by that?
So if you, I don't know who you are, but I know, gosh, moving to a whole new place can be very jarring. So say you are just very unsettled and you need some help with your mental care. So we have like the 3-day minimum if you go in and you're like, hey, I need to be safe. But after that, they might want you to be outpatient. So they're referring you to like a specific therapist or a specific type of therapy. The same can be said for blood work, or if something comes up with your heart. A specialist is just someone that's very focused in the area you need help with.
Mm-hmm. Okay, so I do have a question. So in the past, I went to a doctor who told me that I have diabetes.
Okay.
And then I was supposed to go to another doctor to talk about more about diabetes. Is that the same type of thing you're talking about?
Yeah, absolutely. Just someone that can help you go a little bit more in depth. Yep. And the one, yeah. But with Part B, something else.
I guess
too.
I see that the A plan, that's good, I really want that, but now the B plan, I want that, so what should I pick?
So just one more quick thing about Part B is just if you did get injured and you went to the hospital, you have that covered. If you need like medical equipment, like say you broke your foot and you need to have a chair in the shower, then Part B can help you with that too. And so because your health is related, and often it's both, you can pick both parts. And you liked A and B. I got the list going, right? So I got the A and the B. But if you look at Part C, if we get to that part, that includes that it combines Part A and Part B. And like some of those plans would also have Part D with them, and we can get to what that means.
And I just want to clarify, Part C, that does mean it combines both A and B, correct?
Yes. And sometimes it also puts D in there. And Part D is the prescription drugs.
Okay, so I'm understanding if I pick A and B, would I get C? But then
Essentially, yeah.
D, I guess just hold on, maybe we'll explain, how do you explain what D means?
Yeah, so the D, that is what does the prescription drugs. So A, if you go to the hospital, you get a prescription, great, the hospital is paid for, but the medicine is not. For Part B, you go to a regular doctor's appointment. That is covered. Any referrals or something else, the equipment is covered. But the prescription, if somebody gives you something, that you would have to pay out of pocket. And so Part D, that's kind of the most important part, I think.
So like insulin?
Yes.
Okay. So suppose if I wanted A and B, that means I would get C if I wanted A and B. But then what I need to, for medicine, to get that covered, so would I check C and D for that? Is that correct?
Yeah, it's so complicated because so if you wanted just Part A or just Part B, you would pick them. If you were not worried about them and you only wanted the prescription, you would choose just D. But Part C, that includes the A and the B, and some of them include D, which means that you would pick Part C and then add that like nomenclature that you need Part D as a part of your plan, which because as we previously discussed, you have different income assistance or SSI, SSDI, then that makes it easier because they already know that you'll need help with the prescriptions.
Okay, I'm just gonna clarify. So you mean that if I do check C and D together, is that right? Or check box for C and D?
If you look on the form, so there's the line for A, B, and then with C, there's a few different options underneath it. And so if you want Part D included in that, then you can check that. And then Part D is just on a line by itself.
Okay, that's fine, I understand. So that means I'd have to really look and compare the differences just before I make a decision, right?
Yeah. Yep. And if you have any questions, I mean, feel free to ask, of course.
Okay, so reading this, it's a lot of just strong English, and reading that, I might need your advice. So suppose if I'm diabetic, and I'm only diabetic, and just if I don't have anything else related to my health, I don't have any other issues, what would you suggest that I pick out of these four?
So it's hard to suggest because, I'm not a medical health practitioner who says like, oh, this would be a good safety for you to have. But honestly, I would go with Part C that includes Part D because right now, I mean, you're presumably, taking care of your diabetes, all right? You don't have to go to the hospital, but disaster does not come with a warning. It just happens. And diabetes, there's regular follow-ups. If something goes awry and you need to go weekly until you find something stable, you'll want to have that Part B. And then also, as you know, you have your needles and test strips and insulin, and that's under Part D. So having them all right now is so you don't have to reapply later to add on. You'll just have it all right now.
Okay, so suppose, so you suggest C, that's fine, but should I go ahead and contact my, like, medical staff to check to make recommendations for me, or?
Oh, I didn't mean it in that way. I just mean, I'm advising you as a person because, like, I understand English is so complicated and this is very complicated in addition. It's just that I can't, like, tell you what to do because that's not my place. But if you're just looking for advice, like, I can suggest and explain. The doctor wouldn't really be able to expand more. They would say, like, you have to talk to the insurance person about that. I just meant that I can't tell you what to do, but my advice is to just apply for it all right now because you don't know what'll happen.
Okay, that makes sense. Yeah, I'll go ahead and check the